Welcome back. 8:21 right now. Pretty mild today, but during the summer months, many Americans are prone to the exposure of heat-related illness, including heat exhaustion and heat stroke. Here in studio to tell us how people can stay safe this summer is Dr. Timothy Quinn. Doctor, thank you for coming on the show.
Hey, thank you for having me.
You're kind of helping us define this. There is a difference, I guess, between heat exhaustion and heat stroke. Kind of lay those out for us.
Well, the deal is, what we want to do is help people understand the warning signs, because heat exhaustion is a condition that you can acquire if you're out exposed to a lot of heat. Maybe you're out doing yard work or out running like me, which is bad. But basically, your body has a natural autoimmune process to cool you down. You increase the blood vessels underneath your skin and you start to sweat. But what that does, the evaporation of the sweat will cool you down. But what can happen in intense heat and exertion, you can not be able to cool down because your body can sort of shut down because it gets too hot. You can become dehydrated. But some of the warning signs, you can get lightheaded, fatigue, nausea. At that point, you want to remove yourself from the heat. Go into an air-conditioned building and try to hydrate and cool down. But if you don't get better in, like, say, 30 minutes, you probably want to seek medical attention.
Now, is like heat exhaustion like these first steps toward heat stroke, and that's what you're trying to, curtail?
You're trying to prevent, right? Because if you develop heat stroke, well, at that point, the main warning sign to look for is the person will have dry skin, because the autonomic nervous system can no longer produce sweat, and your system can sort of shut down, which can be deadly. You can actually have a stroke or heart failure. So you want to try to go ahead and seek medical care immediately, like calling 911. But while you're waiting on the ambulance, there are some things you can do, such as, well, first of all, of course, get out of the heat. Try to ice down the areas of most blood vessel exposure, such as underneath the armpits, around the neck, the back. Try to cool that person down. But the bottom line is, if you have someone that's suffering signs of heat stroke, and I'll say again, the skin is no longer sweating, it's dry and very, very hot. Maybe the person is having nausea, vomiting, having difficulty breathing. Some of these patients can even become confused and disoriented, and some people can even faint or even go into seizure activity. So it's a good idea to be on the lookout, but don't hesitate to go ahead and call 911, because it could save that person's life.
Absolutely. Well, you seem to be emphasizing looking out for other people, especially vulnerable adults and maybe children under these circumstances. Is there a temperature that when you see outside where you seems to be most susceptible very quickly? Well,
what you want to do is try to exercise during or limit activities outside during the cooler times of the day, before 10 a.m. and after 6 p.m. But, some people, they want to go out in the middle of the day, like myself, and go running, which is
stubborn.
not a good idea. One lady actually stopped me one day and said, "Well, you talking about heat on the news the other day?" But the bottom line is, you want to stay hydrated. That's very important. And try to drink fluids during your exercise, and that'll help prevent heat injury.
All right, great tips. Thanks, Doctor.